Are you curious about weight loss drugs like Wegovy and Zepbound? Today, we'll tackle the top 10 myths surrounding these popular GLP-1 medications, from misconceptions about obesity to the importance of a healthy lifestyle. We're setting the record straight. Don't miss this essential guide to understanding the truth behind these revolutionary treatments. Hello everyone, my name is Christopher Durham and I'm the host of the Downsized. If you haven't already, please take a moment to like and subscribe. We appreciate your support. Before we dive into debunking myths about GLP-1 drugs, I want to share my weight loss adventure. Like many, I have struggled with weight loss for years, even decades, but GLP-1 medications made a real difference for me. Since starting in September of 2024, I've gone from compounded Tirzepatide to Mounjaro to Zepbound and back to compounded, all with shortages and the whole 9 yards in the middle. I've worked with my local physician who's been awesome to help develop a healthcare and weight loss plan that really works for me and takes advantage of these fabulous drugs. I've lost over 70 pounds and I'm excited to share with you what I've learned along the way. These medications have frankly been a game changer for me, helping me manage my weight in ways that I never thought possible. They've lowered my blood pressure, they've lowered my cholesterol, and they've helped with sleep apnea as well. So there's a lot of good things that have happened from losing 70 pounds and being on these medications. Let's get into the facts and clear up some of the misconceptions about these incredible drugs. Myth number 1. Obesity is a moral failing. First and foremost, I want to say obesity is a complex disease and it is not a moral failing. It's influenced by genetic, physiological, environmental, and psychological factors. People struggling with obesity often face unfair stigma and judgment. Still, it's crucial to understand that obesity is a medical condition that requires the appropriate treatment and support, just like any other chronic disease. GLP-1 drugs provide valuable support for managing this condition and should not be seen as an easy fix. This is not a moral failing. I'll say it again. You're not less of a person. You're not less of a human being. You didn't do anything wrong. Your body has been working against you, and these drugs can help you manage your obesity. It's amazing. Myth number 2. GLP-1 drugs are cheating and the easy way out. This is a common misconception. I get asked about this all of the time. It's amazing how many people almost wish you to fail at this and say, oh, you're cheating, it's going to come back on you. What we know is using GLP-1 drugs is not cheating or an easy way out. These medications are powerful tools for managing weight and improving health, but they require commitment and an effort from the user. They help regulate blood sugar, reduce appetite, and slow stomach emptying, as well as stop that food noise in your brain that's constantly saying survive, thrive, forage for food. It's that constant evolutionary thing that is trying to keep you alive and doesn't turn off when it should. Well, GLP-1 drugs help you do that. And along with lifestyle changes like diet and exercise are still essential for achieving and maintaining weight loss. These drugs provide a necessary support system for people struggling with obesity, which, as I said, is a complex disease influenced by genetic, physiological, and environmental factors. Myth number 3. Taking a GLP-1 drug guarantees significant weight loss. While these drugs have a very high success rate for weight loss, nothing guarantees it. You can beat these drugs. You can out-eat the medication. These drugs help by slowing stomach emptying, making you feel fuller, and by slowing the noise in your head that makes you want to eat all the time or think about food. Clinical trials show impressive results, but everyone's different. The manufacturers of these drugs expect at least 5% total body weight loss within 12 weeks. It's not uncommon. Doctors will discuss dosing, diet, and exercise if this doesn't happen. Remember, some patients will not respond due to genetic or physiological reasons. So, are you going to lose weight? In all likelihood, yes, you are. Is it fast? Depends on how you define fast. Is it easy weight? We'll talk about the side effects in a minute, but this is a daily, weekly thing. I'm giving myself a shot. I'm thinking about what I'm eating. I'm trying to make smarter choice. So it's not easy and it's not guaranteed. However, we do expect that on average, people will lose between 1 to 2 pounds a week. Do the math. It's easy math. Somewhere between 52 pounds and 110 pounds is expected. Can you do that? You probably can. Myth number 4. You don't have to exercise while taking GLP-1 drugs. And I'll tell you, you really don't. So it's not a complete myth, but it helps. It contributes to your weight loss and makes you a happier, healthier person. Even the labels of these medications recommend using them with a reduced calorie diet and increased physical activity. Exercise, especially resistance training, is crucial for maintaining lean muscle mass during weight loss. Without exercise, your metabolism can suffer, making long-term weight management challenging at best. Myth number 5, you don't need to eat healthy if you're taking a GLP-1 drug. This is simply not true. These drugs are not magic bullets. Success with GLP-1 medications also requires changes. Non-adherence to healthy eating is a common reason for less than expected weight loss. That does not mean you have to start a crazy diet or even eat diet foods. In fact, we encourage you to not eat diet foods. Focus on real food. Shop the grocery store's perimeter and eat fresh food. You'll eat less food and you'll spend less on groceries, so make sure what you eat is nutritious and tastes great. Prioritize lean proteins, vegetables, fiber, and healthy fat. Pay attention to your body, digestive system, and side effects. What you eat can and will worsen gastrointestinal side effects like nausea and vomiting. Many people report issues after eating fried foods, drinking alcohol, or indulging in sweets, but your response may vary. Which leads us, of course, to myth number 6. Side effects are unbearable, or the opposite side, they're no big deal. Side effects vary from person to person. Honestly, they vary from week to week, from dose to dose. Your body's going to react a little bit differently to this medication almost every time. Common side effects include nausea, vomiting, and diarrhea, which often result as your body adjusts. Providers usually start patients on a low dose to minimize these effects. If side effects persist and are intolerable, it may be necessary to switch medications. However, patients can manage side effects with proper guidance and symptom management. Pay attention to your body. While I have never had severe side effects, I know many people who have. I have honestly only had minor constipation, which is pretty easily managed with the right fiber, the right protein, and some over-the-counter medications. So it hasn't really been a big deal for me. A little bit of nausea at the beginning, all easily manageable things, but pay attention to your body. You are your own best advocate, and you need to stay in front of the side effects, not behind them. Myth number 7, using compounded GLP-1 drugs is unsafe. This is a common one too, and people will ask you about it all the time. Compounded drugs made by state-regulated pharmacies are tailored to fit individual patient needs. These pharmacies are licensed and regulated by state boards of pharmacy and follow federal guidelines. They are legally allowed to make customized versions under Section 503A of the Federal Food, Drug, and Cosmetic Act. Pay attention to where you're getting your medication. Know your doctor, know your telehealth provider, know who your compounder is. Make sure that you're getting real drugs with a real prescription and you're following the appropriate doctor's instructions. Do not buy from sketchy places. Do not buy from some guy on the internet. Do not honestly buy from any of the fly-by-night weight loss clinics. This is a serious prescription medication, and it should and can be safe if you make sure you're doing the right things. So always make sure you know where your medication's coming from. Myth number 8, your insurance will cover the cost if you're a prime candidate. Well, maybe. Insurance coverage for GLP-1 drugs vary widely. Many insurance plans do not cover these medications, especially for off-label use. It's great. Both Wegovy, which is Semaglutide, and Zepbound, which is the Tirzepatide, have been approved for weight loss. However, that does not mean that the insurers and the PBMs are approving them as of yet. Medicare does not cover GLP-1s for weight loss. The cost can be a significant barrier, with a month's supply of Ozempic costing around $1,000 and Zepbound right in that range as well. Prescription discount cards may help, but checking with your insurance provider and exploring all financial assistance options is crucial. Myth number 9. All GLP-1 drugs are the same. While similar, GLP-1 drugs have distinctions. Ozempic and Wegovy are both semaglutides, but are approved for different uses and have different dosing. Mounjaro and Zepbound, both Tirzepatide, affect two receptors and are used for diabetes and weight management, respectively. Understanding these differences is vital for making informed decisions about treatment. Make sure to join us every Thursday at 7 p.m. Eastern Standard Time for the Downsize Live, where if you have questions, my wife Lauren and I are taking questions and chatting about our GLP-1 adventure. If you have not visited our website, please take a moment and go to thedownsize.org and check it out. The site includes our GLP-1 companion store, where we have curated the products that we use and recommend. It also has a resources page that will show you links to a lot of the research, to the FDA, to the various drug companies, and of course you can sign up for our email list. Thanks for watching. If you found this video helpful, please give it a thumbs up and subscribe for more insights on weight loss and GLP-1 medications. Remember, it's crucial to consult your healthcare provider before starting any new treatment. If you have questions or myths you'd like us to debunk next, please drop me a note in the comments and tell me what's going on. We'd love to hear from you. My name is Christopher Durham for The Downsized. Stay informed, stay healthy, and I'll see you next time.